of the acute dermatolymphadenitis amongst the people with lymphedema means I don't know some dermato అంటే skin lymphadenitis చెప్పాను కదా lymphadenitis lymphangitis అని చెప్పాను కాదు సో అవి ప్రివెంట్ చేయాలి అంటే ఈ గజ్జల్లో వెళ్ళగట్టడాలు ఇలాంటివన్నీ మనం మెడిసిన్స్ some are affected in hands, some are affected with both the legs, some are affected with the breast. So these are the lymphademas. Okay. So what is the flow chart of that management? This is actually the bold one. New one is also there. So whatever it may be, the basic structure and the basic procedure will not change. Okay. What is showing early symptoms? Fever, pain in the groin axilla, along with the lymphatic channels. First step means whenever the patient comes to our office or any filaria clinic, if simple fever is there, he will not come to filaria clinic. Okay, fever means he goes some local RPS or local doctor and he will test the fever, malaria, dengue, those tests he will do. But when the fever is there along with the pain in groin means here the symptoms, small symptoms that gajjallo means lymphadenitis, like streak of reddishness of in the skin. Lymphangitis. So these whenever fever along with these symptoms are there, some suspicion will come that it is filaria. Then he will come to filaria clinic. Okay. So early symptoms along with the pain in the groin axilla along with lymphatic channels. Then suspected and directed by peripheral health staff to medical officer. Some we are there, we will just tell that you might have some filaria symptoms. You go to some medical officer. So after going to the medical officer, what we will do? Clinical examination and test for MF or its antigen. ICP is immunochromatographic test. Okay, any clinical examination should be either NBS or DC provocation test. Already told to you.
Yes.
I told you. So whatever it may be, we will conduct one test. Okay, if it is negative, okay, or it is positive. If it is positive, it is treated on clinical ground. Whatever. Anyhow, he is positive, so on clinical grounds, on second, if any secondary symptoms are there, we are giving antibiotic, we are giving anti-pyretics and everything. Okay. If it is negative, still we have our lymphatic filariasis. Whether he is so most of the time we will not get positives. Then our clinic patients are coming, we don't get positives. But that doesn't mean that he is not filaria patient. Okay. MF దొరకలేదని చెప్పేసి నీ ఫైలేరియా లేదని పంపించలేము మనకి. If it is lymphedema, whether it is to legs or hands, whether it is to breast or genitalia, whether it is unilateral or bilateral, we have to see and then we will visit the health facility and manage home basic healthcare. And if he is without disability, whether he is having hydrosis, means one testicle swelling or two testicles swelling, and then simple operation at level 2, and if it is complicated, level 3 in medical colleges we will send. Okay, if it is hydrosis, we will do hydrosis. Okay. So this is one of the new guidelines according to the person presenting with axillary lymphadenopathy, swelling, pain, red streaks, lymphatic means with or without fever symptoms. If it is no, okay, not a case of acute lymphatic filariasis. To rule out, if these symptoms are not there, you have to rule out from the lymphatic filariasis. Other fevers, either malaria, typhoid, dengue, you have to check. If these symptoms are not there, if these symptoms are there, yes, then residing in our travel history is there in the lymphedema, and if he is having these symptoms, we have to ask you are from which area, whether you are from the endemic area or not, whether you have gone to some endemic area, whether you traveled to some Bihar, Odisha or Uttar Pradesh or Kerala, you have traveled, why you got these symptoms. So we have to ask that. If yes, he told yes means, then again suggest acute lymphatic filariasis features are there. Then we will go for diagnostic tests. Either FTS you are doing or MTS you are doing. Whatever you do, if it is yes, again management only. What we can do for lymphatic filariasis is management only. It is not that to prevent. No, take one like dengue. Okay, platelets you are giving after a certain period, he is okay. Lymphatic filariasis management. Once it is affected, lifelong we have to suffer. That is the truth we have to tell patients. Once you are affected with lymphatic filariasis, lifelong you have to take the medicines. At least for 6 months in a year you have to take medicine. Okay. So the management of acute stages, treating infection with analgesics. So based on the symptoms, we have, if he is having wounds, we are giving some antibiotics. If he is having itch, symptomatic treatment. For itching, we are giving some antibiotics. anti-allergics, wearing antifungal, antibacterial ointments, based on the symptoms. Okay, management after acute stage subside means here we are giving single dose DA or IDA followed by 1 days of DEC dosage. Then we are giving the tablets also. Then follow up also. Follow up of patient and repeat analysis for every 6 months. We are giving DEC after 6 months. We are seeing whether he is microphylalia less in number or more in number. We have to do. Okay. So this is the management of treatment schedule. Schedule A, B, C, D. Actually, WHO have given some guidelines for this like stages. But for our guidelines, we are reducing. Actually, according to WHO, there are 7 stages actually. Simple means based on the disability, we get given 7. But we just done 4. In the yellow form only we can read. Reversible grade 1. Means schedule A means night time walk ఉంటుంది మార్నింగ్ తగ్గిపోతుంది అట్లా ఓకే it is reversible, the swelling is reversible. It will be there in the night time after sleeping and keeping elevated, morning time the swelling is going again, day he is complete day he is working outside, again coming swelling again night he is keeping the leg outside, morning that is stage 1. It is a reversible. For those kind of schedules, just washing, drying, elevation, exercise, footwear, massage, bandage and psychosocial support should be there for this one. Then what is schedule B? Schedule B is with shallow skin folds, small folds, because of the increase in the size of the leg, small folds happens. Okay, small folds with deep skin folds, knobs, mosses, warts. I showed you in figures also. So they are considered schedule B. For them also same. Skin hygiene, washing and drying, exercise, elevation, footwear. Okay. Then with interlesion. Interlesion means in between the fingers or in between the folds, the skin is delicated. So entry means you know entrance. Lesions means holes. Okay, the holes for what? For bacteria and fungi. Okay, entry lesions. If any person affected with the lymphatic filari is having entry lesions, he is having more chances of attacking the secondary infection, inflammations, acute inflammations and everything. So for that one, we have to detect the entry lesion very quickly. Whether the skin, once I will tell in Telugu, improve column work. The cleaning of entry lesions is also very important. Okay, applying antifungal and antibiotic creams. Washing with potassium permanganate, it's smelling. So potassium permanganate solution will be there. If smell comes during this entry lesions and everything, because why the smell is oozing of the lymphatic fluid is there. That's why some bad smell will come. When the bad smell is coming, you have to wash with potassium permanganate and no scratching or punching. That's why if any patients come, we should not tell don't scratch with your nails. If itching is there, okay, so slowly, steadily you do like this, not with nails, because there is a chance of getting holes and entry lesions again. That's why no scratching or punching. Okay. Schedule D with acute attacks. Same after entry lesions, acute attack because bacterial fungal infection already started. Those will be acute attacks. For them also, based on the symptoms, we are giving the treatment. Okay. Cold application, inflammation means reddishness. So cold application, we will ask them to keep in cool water, bucket water. We will ask them to keep the water for just cooling, or wet cloth. You just tie up the wet cloth, cold water, because the inflammation should go. Then again drying, exercise, everything. So we should tell the patients not to use hot water to their legs. Hot water should not be used because hot water may damage the skin. That's why we will ask them don't use hot water. Okay, they should not do exercises. People with acute attacks, they should not do exercises. They should not do bandaging also, because the blood flow also it is the remaining one they can take bandage. During night time they can remove, daytime they can put the bandages. But people with the acute attacks and everything, they should not use the bandages. Okay. So they have to drink plenty of fluids, water they have to take. Okay, see, images you can see. This is the stage 1. Okay, see this slide. Small swelling is there. Again, it will come like this. After elevating, after keeping the night time in the upside direction, it will turn into normal. Okay, the swelling reverses at night. Skin folds are absent. Okay, appearance of smooth skin. Just affected leg and unaffected leg will be same normal, but just a small swelling will be there. Coming to stage 2, this swelling it is not reversible at night. Even after keeping the leg upside also, the swelling sometimes it is not reversible. That comes under stage 2. Okay, skin folds are absent. Okay, appearance of skin smooth and normal. Now see the shallow folds I told. Okay, shallow folds means this type of foldings. Madatal pattam. Okay, this is the stage 3 actually. See, you can observe the stage 4 difference also. Okay, stage means skin folds are very shallow and knobs and nodules are there. See, knobs and nodules started in the leg. Coming to stage 5. Okay, deep skin folds, not shallow skin folds, deep skin folds. In this deep skin folds, there is a high chance of bacterial infection because they cannot clean that foldings. These foldings they cannot clean. Already it is very tight. That's why this stage is not reversible and it is also very difficult. Coming to stage 6, swelling not reversible at night. Appearance of skin is wart-like lesions. చిన్న కాయల్లో వచ్చేస్తుంది. Means small wart-like structures appear on the skin. Okay. This is stage 7, bedridden. This is the last act. These are all according to WHO. Okay. This is bedridden. He cannot even move. He cannot go to wash. He cannot pull all the leg. So needs help for daily activities, walking, bathing, etc. They need some help. They are dependent on some other people. Okay. So early diagnosis of initial acute infection and prompt treatment is crucial. Particularly in endemic areas, people should not ignore the clinical features. So they first they are ignoring all the things, but that is what we should tell. If you are in an endemic area, if you are having any symptoms, you should not ignore. You have to take the treatment. Okay. Treatment. So initially, what if we take treatment, then we can stop the transmission as well as the getting the leg affected. Initially, we have to take the treatment. Some patients now after this much swelling, they will come to clinic and they will ask, what they will ask, sir, we cannot do anything. If he comes initially, there is some chances of doing anything. Okay.
Stop the swelling and something is fine. Early comes, early diagnosis and the prompt treatment.
Okay, these are the interlesions in between the fingers. Okay, and the management prevents acute attacks. The interlesions include small digital fungal infections, small wounds, blister line. ఏ ముళ్ళు కూర్చిన కొంతమంది బైక్ కిక్ కొట్టానంటే అలా చీరేసింది ఏమేం చెప్తే దెబ్బ తగలకుండా చూసుకోండి అని చెప్తాను ఏ పేషెంట్ కానీ. హ్యాండ్స్ ఆల్సో see daily examination of skin for interlesions. The affected person every day he should see the legs and also hands. If anything is there, he have to do protection like this. Okay. Carefully washing the limb, showing the interlesions, wash with soap and cleaner. See, separate soaps or separate liquids are not required. Generally, what soap we are using, we can use that only. Okay. Application of antibiotic ointment after drying. See how much washing is important. Drying is also important in the same way. After washing, we have to on the skin. See, this is our one lymphedema management in Kerala actually. This is our staff only. In Kerala, like this, they used to conduct in the olden days. This how to take care, they are explaining this. Lymphedema is the main problem in lymphatic maladies. It mostly worsens due to negligence of initial treatment. Initially, if we don't take treatment, it will be worsens. Okay. Once lymphedema develops, it cannot be reverted to normal condition after certain stage. So, yes, same. I told gravity. Due to the gravity, the lymphatic fluid starts distributing all over the body without accumulating at one single place. Okay, that is why we are keeping this one parallel. Okay. Every day the affected part needs to be observed keenly to detect the points, sites, interlesions, especially the interdigital. Interdigital spaces means in between the fingers. Attention should be paid to the cleanness of the toe web spaces. Cleaning should be gentle and rubbing. So we have to smoothly like this. Don't apply any gentle pressure or without any scrubs. You should not use. Smoothly we have to use the affected area. In case of unilateral lymphedema, the normal leg is to be washed first, followed by the affected leg. Okay.
Unilateral
Unilateral means single leg is affected.
Bilateral
Bilateral means
two
both
legs.
legs are affected. In case of unilateral lymphedema, first of all, normal leg should be washed. Then only the affected. ఈ కాల్లో బాగుందండి, ఒక కాలుగా ఉంది. ఫస్ట్ ఐ హ్యావ్ టు వాష్ ద నార్మల్ లెగ్. అది వాష్ చేసిన తర్వాత ఇది చేయాలి. ఎందుకు ఇది కూడా చేస్తున్నామంటే ఒక కాలు వచ్చిన వాడికి రెండో కాలు కూడా వచ్చే ఛాన్స్ మన బాడీయే కదా, ఇది మన బాడీలోనే ఉంది. సో సెకండ్ లెగ్ ఆల్సో విల్ బి ఎఫెక్టెడ్. దట్స్ వై వీ హ్యావ్ టు వాష్ ద సెకండ్ లెగ్ మీన్స్ నార్మల్ లెగ్ ఫస్ట్ and then coming to the affected leg. Whereas in case of bilateral, the more affected leg should be washed first than the less affected leg. Okay. So drying, see, with cotton cloth they are drying. Drying should be done carefully and gently, being more attentive to the affected parts, skin folds and interdigital spaces. This will reduce the moisture. Moisture and tadi chamma, it will reduce that one. Thus minimizing the risk of intertrigo. Intertrigo means going inside, means the parasites to enter inside. Precautions should be taken not to rub the skin to avoid injury. In case of fungal or bacterial infection, appropriate ointment should be used. Okay. See, next one is exercises. What exercises? Not heavy exercises. Not going to gym or anything. Just in home only. Just see.
Simple.
Simple exercise. Just raising up and down on the toes. Okay. This is simple exercise. That can be done on the standing or sitting. Okay. If any acute attack is there, I have already told you, exercise should be avoided. If he is suffering from any acute attacks, exercise should not be done. Okay.
Simple exercise.
Yes. Okay. Towards upwards. Okay. Massage towards upwards means nearly. Fluid anta evenly spread ayalaga gentle massage should be done. Okay. It is advisable to check that while doing massage we should not have any nails. If it again causes any scratch, again acute attack will be started. Okay. This helps in the nasal drain of excess fluids. Same principle. Okay. See, while cooking also she is keeping the leg parallel to her body surface. Okay. Just to move the lymphatic fluid.
Balancing the lymphatic fluid. Balancing the lymphatic fluid.
Balancing and also to reduce the swelling actually while working, because ladies no they cannot see they will not going to any work in house only they have to do. If they use these kind of remedies, it should be some means the burden will be somewhat less actually the disease burden.
And it may be reversible also in past
Yes,
cases.
that is why. Yes. See, while sleeping also, he is keeping one pillow under the leg. Okay, the pillow is kept under the leg, so that some elevation is there. When the leg is elevated, the fluid starts going back. Okay. Proper footwear. They should always use proper footwear, not tight footwear and which are affecting the legs. They should not use comfortable footwear should be used. Okay. Somewhat loose also. Management of hypercell activity. If he is comfortable, he can take medicine and leave. But if he is feeling very discomfort and anything level 2 or level 3, he should go to the nearest health center and get it operated. Hypercell activity. Okay. These are the washing, drying, exercise, use of proper massage, elevation and use of proper food. Okay. This is the overall morbidity management. Okay, advocacy activities means IEC act. We have to tell them that we have to teach the patients, we have to give awareness, we have to do means we have to tell the public also. This is not any means some are having a patient in the beside side house. This house people they are getting afraid. He is having filaria, I will also get. This is not person to person transfer, but this is only mosquito transfer. This we have to.
Many bites.
Yes. Even the capacitor, this should be developed. What we are doing, that is on this side. Capacitor helps them through development trainings, enhancing their skills. Because if you know all the symptoms, how it is, now you have learned everything, life cycle, you learn the symptoms, you learn morbidity. Now you can tell people, your surroundings, you can explain them. Okay, the medical officers, multi-workers, health workers, Anganwadi workers, Asha workers, okay, different health units, they should be trained and sensitized to participate in the LF related service delivery. Okay, IEC means information, education and communication. Okay, that should be given. Morbidity management programs need to be widely published through electronic media, mass media, printing means advertisement should be given. If more number of cases is there, the publicity should be more. Okay, empowerment of persons with lymphedema means to support these groups. Some NGOs or some support groups should be there to support the people to create the self practices, and we have to give the moral support also. Okay. See, last time you asked whether the operation is there, the surgery is there. See, in the Kasaragod, Kerala, see this one, Institute of Applied Dermatology, Kasaragod, Kerala. They have done this one. In 2010, they have done. After 72 days, that leg turned this way. Okay?
There is no use.
See, some use is there, some, but after that again it will, was wherever the body fluid is there, that will accumulate there only. For some time we are going to remove, but